Okay, friends, Dr. Mary Starr here, and unfortunately, let's see. Okay, so unfortunately, I couldn't make a video on my phone, and I couldn't get on my Dr. Mary page, so probably all my friends now are like, what is she doing? This is for my Total Wellness Dr. Mary page. If this isn't for you, that's fine. Particularly, I'm talking to women right now. I see some of my great friends, Judy and Jenny. Jenny just had her first baby a couple years ago. This is going to be a really great video for you. If you have a uterus or you don't have a uterus anymore, this is going to be a great video for you. Okay, so years ago, my story starts with this technique that I'm going to show you, a little bit of this technique I'm going to show you. My story starts with an amazing woman, a nurse, who had terrible, terrible back pain to the point where she was disabled. And it was just awful, 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 awful. And so she spent a lot of years as a nurse and helping people and doing her best and all of these things. And then she ended up...
Wait, I see Mama.
Hi, I'm doing a live video.
Okay, bye.
Bye. Okay, see you later. Thank you. Okay, so back to business. Okay, so, oh good, Kim and some of you are on. I know you will like this. Trina. Yes, awesome. So she spent all this time and had terrible back pain, and just how God kind of put things in her life. She ends up at the seminar with Dr. Rosita Arvigo. You can write that down, Dr. Rosita Arvigo. And I don't know if I think she's a naturopath or something now. But anyway, so, and she spent like her last dollar to get there, and she gets this seminar, and Rosita's like, okay, so who wants to be on the table? And Deb just goes and she gets on the table somehow, and she ends up being adjusted. So she shows this technique called the Arvigo technique, which is kind of like an organ massage, all external, and it's particularly to do with the uterus. And Rosita Arvigo studied many, many years in Belize and Latin America, and they believe that the uterus, right, just like the colon, many of us have heard my talks and Gary Young's talked about the colon being the center, the hub of health. Well, in that country, in Belize, they believed the uterus was the kind of the center of health. And if you know the anatomy of the uterus, basically, right, it's kind of down here in our lower abdomen, above the pelvic bone, and it rides on these ligaments called the broad ligaments, and it's like a jolly jumper, okay? So even when you're a little girl, or you know, you're a grown adult and you've had kids or whatever, you have this uterus that's on a jolly jumper, and all of us have maybe been to the doctor and say, oh, your uterus is tilted, or your uterus is back, or, you know, and you think, well, I must have to live with that, and that's not the case. And I know you can't see my head, but I want you to focus down here for a little bit. So, so many times women who get constantly constipated, sometimes their uterus has fallen back on the colon. Sometimes they're always having to pee, or maybe getting a lot of urinary tract infections. Sometimes the uterus has fallen forward. Sometimes it can squish down. Now, a big way that you know that you might have one of these problems too is when you do have your cycle and you have terrible, terrible cramps, and you have what looks like old blood come out. So it looks like really dark blood that comes out initially when you are having your cycle. So that's one of the ways that you might know that your uterus is folded over, it's cramped, it's not in the position it should be. So Rosita gets Deb on the table. She adjusts Deb, and she does this whole thing. I'm not going to show you the whole thing. I'm just going to show you a couple pieces of it, which is the self-care piece. And Deb gets off the table, and she literally has sensations and circulation down her legs. Her back pain is almost alleviated, and it's just like, it's miraculous, absolutely miraculous. So she starts following Rosita and training with her. And she's one of the very few who have actually got to train with Dr. Rosita Arvigo and learn this Arvigo technique. And Deb has, to her credit, many women that she has helped, not only with who had terrible periods or endometriosis, fibroids, all those things, but she has many people who've gotten pregnant just from a few sessions of this thing. And I don't want to give their names out there, but some of you probably know some of them. So if they're on, maybe they'll tell you. Okay, so Deb gets this this technique, and then she does this for me, and I'm like, what? And I never really had too many. I had probably cramps a little bit, and you know, when I first met Deb, I was just starting to get chiropractic care, start using Young Living oil, so I was on that path of getting healthy already, and so Deb starts adjusting me and do this technique, and I'm like, wow, you know, and I haven't seen her since my daughter was born, so like 4 years ago was the last time I got adjusted, but I do this regular self-care, and I don't have cramps, and I don't have all of these things. So if we lived in Latin America, particularly Belize or Honduras and places like that, our moms would teach us this technique, okay? This self-care technique, part of this. Now, our Vigo Massage has all these different components to it. It has herbs and all these different things, but the core, the self-care is really, I think, important. So even if you have a hysterectomy, you might have a little scar tissue in there and things like that. So doing this kind of belly massage is super, super important. So let's talk about that, okay? So basically what it is giving yourself I don't know if you call it a uterus massage, I just say a belly massage this way. So you're going to take this part of your hand, right? What do we call this in chiropractic? I forgot. The pisiform's here. The knife edge? Okay, that's what we call it in chiropractic. You take this and you're going to walk down to the bony part of your pubic bone. So you walk down soft, 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 hard, right? Right there. So you take this knife edge of your hand and you're going to pull up. And my friend Simone probably knows about this. She has worked with a lot of health clinics. The Arvigo massage is what we're talking about, okay? So the self-care portion of this. And I'm basically pulling in and then pulling up towards my belly button. Now my belly button's way up here, right? But I'm gonna pull up straight. And I wish you could feel, because I've massaged a lot of my friends and raindrop clients' uterus. It's all external. You put a towel down and you can do this. You do this through pants. It doesn't matter. Annette, a great technique for you to learn for your practice too. So our Vigo massage is what it's called. I'm just showing the self-care portion. Okay, so we're going to go down and we're going to lift that up. And what you'll start to feel, like I know all our bellies are different, right? Some of us have bigger bellies or not, but what you'll feel down here is kind of like a paunch. I call it like a little paunch. If you think of the uterus kind of as like this, right? It'll kind of start to feel squishy, right? When you get it in its right position. Then you're going to go to the side, right? So here's like, I forget the technical term here, inguinal area, but you're going to go with it like where your leg lifts up here. And you're going to go through and lift, lift, lift. And when they do it, I mean, they're really digging in, and at least when Deb does it and stuff too. So it's a much more therapeutic. This is just some self-care that you can do. So again, the knife edge of your hand, walking down to this bony part, pubic bone, up, up, up. Okay, you can go to this area, the side, right, where this, and that can be really tight for people. You know, massage, and then the other area, massage, massage, massage. So basically I'd be using this other hand. And some people go in, you know, with their fingers like a, I don't know, what would you call that? Like a backhoe, and pull, pull, pull. And I can even feel for myself like punching this. If you're on your cycle right now, I wouldn't suggest doing this. Okay, but if you're off of that, that's fine. And you're massaging. Now, what'll happen, because a lot of us women, right, we bend over, we hold ourselves like this all the time. We've got these tight pants on or whatever. So there's a lot of congestion that happens all through here as well. Okay, so you're massaging up, but you want to make sure the whole belly and the whole colon is massaged too. Now, when you're in the shower in the morning, it's a great time to do it. You know, you have soap and you can just do this quick. Ladies, you should be doing this every time you have sex It's going to reposition your uterus. It's going to be much more comfortable for you to get everything in position. Or if you ride horses, if you're a runner, anything like that. I see some runners who just got on. You know, really, really important to massage this area. So, once again, for the uterus, we're going to come down with a knife edge down to the bony part, the pubic bone, pull up, 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 to the side, over, over, over. And what you'll start to feel is that uterus will start to get like spongy in there, okay? And then over, 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 good. And Mary's had this done. Mary, make some comments about about the Arvigo massage, if that's my Mary friend who's had it. Okay, and then you massage. Now you want to massage what you'll feel. They call these armor rings, I think, in Vigo Massage. But, you know, your diaphragm's right in here. But we really can get very tight and a lot of lymphatic tightness in here. So it's very, very important. I see some of my other doc friends on. So I did this in my chiropractic practice because I had a lot of women who had issues with urinary incontinence or bladder infections or just bad periods, all of that. And I would just drape a towel over them. If, like Heather, if she's doing massage, a person might be more naked. So you would drape a towel here and drape a towel here, right? So you can get to their belly. And Heather, you could do, you know, like do the pulling here, but then do all of this massage in here. And you could use your oils and stuff like that. What would I use? I think maybe like some Sunlight Magic might be nice for the skin and everything. Geranium oil is really nice. If somebody's all needs some digestive skin support, maybe some Digize, whatever. They could take Digize Vitality. They need that digestive support too. Peppermint's nice. It's nice and cooling. But use a base oil and then you massage the way the colon goes. Okay? So you're going to massage in here where this is really tight, but also the direction of the colon too. This is for my therapists who are on the watching. If you want to do this yourself, this is awesome. To give yourself a belly massage is really good, especially if you're like me and you tend to hold weight in this area, or you tend to like protect yourself a lot, or you just kind of, I don't know, I don't want to get down that path, but it's another direction we can talk about. But it's very good on a lot of different levels. So I would recommend using your essential oils if you're going to do a full belly massage. Otherwise, you're just going to come in and do that that uterus self-care where you're massaging. You can do this every day, really. Like I went for a run this morning and I can tell I already feel better. You'll probably poop better. Even if you don't have a uterus, this is just so good to care for yourself and to make sure everything's in position. Really, really important. So any questions that I can answer about uterine care? I'm not licensed in the Arvigo massage. It's quite an in-depth kind of thing. And I will tell you, like, my friend Deb is like one of the best too. It's kind of, I've been to other people and Deb she's just incredible. Really, really incredible. She's in Buffalo. Deb Monteleone is her name. And she's a nurse there and does this technique. Yes, awesome. Very, very good. Okay, so I hope that that's helpful. Yeah, she's in Buffalo and stuff too. I hope this is helpful. Just a couple quick, yes, Buffalo, New York. There are a couple quick testimonies. One of my patients and buddies, good friends, she had like flown to Orlando and she had like the worst UTI ever. She's like, I don't know what's happening. I keep having these UTIs. So she was in my practice and we did this massage on her belly. Well, what about a belly binder? I have this thing in front of my phone. So I think Beth just asked about, yeah, she recommended that, Beth, after you have a baby. It's very, very important. I think you know more about that than me, though. Belly binder when you're pregnant, just to help keep things in and also afterwards, just to help you. See, I'm trying to get good for you. Yes, belly binder. And actually, I found it was really good when you get your period. One of the things I learned from Beth too, or Deb, is that Beth reminds me of Deb. They're fantastic people. But anyway, very vibrant, fantastic people. One of the things she says, when you have your period, and I'll go back to my story, I didn't forget. When you have your period, you want to make sure that you aren't like physically straining yourself. Like, you know that rule, like don't pick up more than 10 pounds of, she talks about like you shouldn't move boxes when you have your period. Like that first day you have your period, you should take it easy. You should wear, I don't know, Spanx or something like that, just to kind of keep yourself, because you have like, I don't know what it is, like a pound or two, like, right, holding in this uterus. So it's important. Geranium oil, Gentle Baby were some of her favorites to use topically. Endoflex, people like Digest oils. All those oils are awesome. Even lavender, peppermint, because you're massaging over the liver too, like all the Juva oils and stuff too. Release oil, you know, look in, do some of your own research and see what your body needs. Some people like forgiveness, liver release. I always tell people put Joy over the release oil. But anyway, that's going into a different class. But my girlfriend, I adjust her. No more UTIs. No more UTIs. Isn't that awesome? I mean, for years. And I've seen that happen over and over and over. You got to get your uterus adjusted. You got to take good care of it. You know, and you just might have a tendency, because some of you have had a lot of babies too. So the ligaments, or, you know, I see a dancer on here or something like that. It's very easy for it to be fallen in one position for a long time. If you're finding like you're constantly having to pee, and you know, why? Is that uterus falling forward? Get it back in position. Hey, I don't have to pee all the time. Does that make sense? So this will not show up on a Zytoscan. Oh yeah, I guess you could Zytoscan yourself to see what oils you needed, but this is just about self-care of the uterus, and one thing that you can do for that. Super, super important. If you don't, you down the road can end up with some things like, you know, not good things. And I'm not going to talk about pelvic floor right now, exercises. I think there's some great things out there right now that are teaching some of that. And I've learned, I know some of you know, physical therapists that actually are in that realm and things that they do. So just some things for your uterus. Okay, hopefully that was helpful, and we'll talk to you later. Bye.